Hello, everyone, and welcome to another webisode of All Politics Are Local. I'm WSAV.com now reporter John Dowding. Every week, we take the time to break down some of those big headlines coming from Washington and Atlanta to see how it helps and how it impacts us right here in the Coastal Empire and Low Country. Today, I'm being joined by WSAV Atlanta Bureau Chief Archit Seshadri. Hey, Archit, how are you doing today?
Hey, John, I'm doing well. Another week, almost the end of the month, which is crazy. We're almost in September, believe it or not, but 6 months through pandemic, huh?
It definitely still feels like a Georgia summer as we head into September. That's for sure. But I mean, a lot of big big headlines were coming out of Atlanta last week in terms of just related to COVID-19, specifically talking about the change in regulations from the CDC. CDC is based in Atlanta for those who aren't aware of that. And they originally were saying everybody get a vaccine. I should rephrase that. They were saying everybody should get tested, and kind of saying
So we want everybody to get a vaccine when it's out, but that's another story.
get to one. Obviously, I'm thinking ahead. But yeah, so they wanted everybody to get tested so they could try to figure out a better way to track it in the community. But now they've reversed those regulations and caught a lot of slack because of that. Archit, I know you spoke with a lot of researchers from CDC, Emory University, a lot of officials in Georgia who were kind of on the cusp of the latest developments in this COVID-19 research. What were they saying about this change of pace from the CDC?
Yeah, John, you know what's interesting about all of this is when all of this broke out in March, we obviously didn't have a lot of testing. In fact, very little testing. So the CDC was the only one doing the testing when COVID-19 broke. And as time sort of progressed, the State Department of Health, private labs, testing was ramped up to get more of the population tested. Very interestingly, last week, the CDC put out a statement saying that only people who have symptoms of the coronavirus should get tested. And naturally, lawmakers, researchers, doctors, people were wondering that did not make sense. Why are we sort of taking a step backwards? So we took those questions directly to the CDC. Are they running out of tests? Why that change now? And could this have been political pressure? The CDC then retracted and sort of changed their stance, saying, you want to get tested, you can get tested. We just think it's only necessary for people who have symptoms to get tested. A lot of the doctors that I spoke to say that even asymptomatic people who don't show symptoms of the coronavirus, can spread the virus. I mean, clearly, we're in a pandemic with the US being in the epicenter. So a lot of people who do spread it don't even realize they have it. That's why there's a lot of shutdowns and mask mandates and things like that. So in fact, listen to what one of the lawmakers I spoke to earlier had to say about where Georgia sort of fares up in all of it.
We're 6 months into this. It should be everyone who wants a test, everyone who needs a test can get a test, full stop. We should be well past the point of prioritizing tests for at-risk individuals.
So the interesting question about this is who should get tested? Most people say if you have the symptoms or if you feel like you've been around someone who is exposed to the coronavirus, absolutely go ahead and get tested. There's certainly state testing, private lab testing. There's a lot that's happening. So the CDC certainly receiving a lot of slack. They were also sort of in the sidelines. We didn't hear from the CDC for a long time until more recently. And again, that could also be a political move. But the CDC coming back and saying that, we are willing to test and we are doing it, but this is our priority. So some interesting conversations about who should get tested.
And I mean, something big also too we've been talking about it a lot locally. I know some of my colleagues here at WSAV have been doing stories on this because we're coming into flu season. As if 2020 couldn't get any worse, literally. We're in the middle of a pandemic, and now we're coming into flu season. And also, too, a lot of scientists, researchers have been anticipating that we may hit, we're still in the first wave, but we may see a resurgence of cases or a second wave of coronavirus in the fall. So, Archit, I know also last week you spoke with more public health experts about the developments for the COVID-19 vaccine. Again, a lot of that research is going on right here in Georgia. The first woman in the country to receive the vaccine was actually right here in SAVANNAH. And so now we're seeing and we're learning more about this vaccine and how it's faring from researchers right here in the Peach State. So Archit, what are they saying about what this vaccine may look like? Is it going to be something like the flu shot, where every year we have to go out and get it and, hope that they get the right strand? Is it going to be one vaccine? Is it going to be, we have to get two different ones? what are they saying about this?
Yeah, a lot of the researchers are sort of wondering that exact same question. There is a little bit of good news in the midst of this global pandemic. The Southern Hemisphere has already had its winter months and the flu season there. So researchers from Emory, the CDC, the Mayo Clinic, folks that we reached out to, say they are looking at how COVID-19 impacted the population with influenza in countries like Australia and New Zealand. Now, keep in mind, the populations are also far less than what we have here in the US. But they say when people wore masks, they did see a reduction not only in COVID-19, but also flu. So the mask, in addition to a vaccine, could be the key to spreading the influenza virus and the coronavirus, so two viral infections. So that is a little bit of good news because they say that we actually may see a downfall in the flu because it's spread air to air. So if people are wearing masks, that is a good thing. We saw that there. Again, the caveat is wearing those masks and practicing social distancing, washing hands, all that protocol that we're familiar with. When it comes to the vaccine specifically, they're also looking at who gets it. They're not going to have enough for the entire world. There's more than 7 billion people. There's got to be priorities on who should get it and when they'll get it. And a lot of research is now looking at maybe the high-risk populations, folks who are older, folks who are pregnant, folks who have existing health conditions. And some of the clinical trials right now are showing that it could be 2 doses. So you'd get a dose, and then you'd wait a little bit and come back and have another dose. Of course, that also puts perspective of like right now with flu season kicking up in September, people can barely get out and get 1 shot. And then you have your anti-vaxxer, you have that whole community. So this is going to be the test of the human population, the biggest vaccination program when a vaccine is out and who will get it. And to achieve herd immunity, that's basically when like the measles or polio and the entire population has enough immunity to it that it's sort of not as a pandemic as it is now. That will require 8 out of 10 people to get it, 80% at least. So in the US, about 200 million people. So not only do we have to wait for a vaccine, we have to make sure people get the vaccine. So lots of moving parts here.
And I think too, you bring up a good point about, because it was kind of related to my next question about identifying those high-risk populations. Question I had, and one of my colleagues had when I was talking to her about this, was how are public health experts going to try to combat shortages in the vaccine? Like you said, it's not like they could just pop out 6 billion vaccines and God forbid if they have to do 2 rounds of it, they can't just pop out 12 billion vaccines all at once for every single person in the world. So the way for them to address these shortages then is by identifying those high-risk groups first, giving them the vaccine first once it's developed, and then turning their attention to the population at large.
Exactly. I think that's going to be sort of the key to all of this. And one thing that when I was speaking to some of the researchers and doctors, a lot of people say that they're a little concerned about the vaccine. Like, yes, it's great to have a vaccine, and that's sort of our only cure, if you call it right now. But this vaccine has been pushed in terms of timelines. Typically, this is not the normal timeline for a vaccine. It goes through trials and iterations and different study groups and a placebo and all these different iterations. This is a much more exponential timeline. So some people are concerned that even if there is a vaccine out, how reliable is it? Is it safe? Is it important to be the guinea pigs of this vaccine? So I think it'll be interesting who doctors decide to give the vaccine to. It looks like groups that are high risk, people perhaps who don't have a whole lot of options, who could perhaps still take the vaccine. They're like, well, we don't really have a choice. Sort of like, your stage 4 cancer. At that point, it's like, well, here are your options. You can either take it or not. It's, not to sound morbid, but, or death. So I think people like that in a very volatile group are going to be the ones who may be the guinea pigs for right now because they don't really have an option. But I think doctors are going to certainly look at those older folks. There's also a lot of studies about racial, people of color, Latinos, African Americans, groups that typically don't have access to medical care in rural populations. So there are certainly a lot of populations. There's certainly a lot of groups that may get it before others, but only time will tell. All we can do right now is control what we can, and that's social distancing and the masks and washing the hand and getting your flu shot. So doctors did emphasize that. Get your flu shot because we know that works. So I got my flu shot this weekend, so I'm a little ahead of the game. Hopefully it'll last me through flu season and COVID season.
Yeah, I got to add that to the list. But the good thing that we know, like you said, the number one thing we got to do is wear our masks wherever we go. Obviously, it's proving to be extremely beneficial wherever it's being utilized, mask mandates and stuff like that. Something else that I've seen pop up as well is related to, it's this like, again, this isn't Georgia state law. This is a federal law. It goes back to, I want to say, the early 20th century, end of the 19th century, talking about smallpox and talking about how the government can mandate people getting, like forcing people basically to get a smallpox vaccine then. And so people are wondering, can the government use that as a way to force people to get the COVID vaccine now? Did they talk about that at all? I know I'm kind of throwing a curveball at you with that question, but did researchers say anything about that, or is it still going to be kind of just like how with flu vaccine, the flu shot is a choice?
Well, the researchers did not, but lawmakers, I did speak to some Georgia lawmakers. I spoke to several different lawmakers who are based in Atlanta and who even talked about the session, the Capitol session, the General Assembly getting together in January. We're not that far out. We're a few months out. They did talk about that, there's sometimes power by our state leaders or our government officials in terms of mandating a vaccine. But the problem is you have to first have enough of the vaccine to give out. So it's sort of two different equations. One is enforcing it. Two is the quantity. So if we, with the population of the US, and you have to have enough vaccines for everybody, first of all. And then you have to make sure everybody gets it. And then we have to see, is it dose 1, dose 2, et cetera, et cetera. And then you have your groups, the anti-vaxxers, who may not even want to get it. So then we talked about, what about in schools? If you have, when you get your MMR, all your shots before going to school. Now, is there going to be a regulation in schools that you have to have a COVID vaccine to get into the classroom? Otherwise, your kid can't come to class. They have to do virtual. I mean, there's all these discussions that it's a Pandora's box, all these conversations that haven't happened yet, but we don't even know how those will happen, right? Because some people might be concerned about autism. That's usually the case that, we don't want all these vaccines, and especially with this timeline of this vaccine being so rushed. So certainly it's going to be an interesting 2021, but we'll have to see what researchers are able to do and which countries will also get it. I know the US, there's a lot of companies here, but that's going to be another fight. Which countries will get it? Will it only be certain global powers that will get the vaccine?
Yeah. Well, thank you as always, Archith, for talking about these big topics going on, as if 2020 wasn't crazy enough, talking about vaccines and all this other craziness, but at least we're hopefully closer to there's light at the end of the tunnel. That's the best way to say it. So thank you so much, Archith, for joining us today.
Absolutely. And get your flu shot if you don't already have it.
I'm going to schedule that now, I swear. You can see more of Archith's stories on our website. Just go to WSAV.com. And you can also catch up on previous episodes of All Politics Are Local on our website right now. Just go to WSAV.com/allpoliticsarelocal. Thank you so much again for watching. I'm John Dowding. We'll see you again next week on All Politics Are Local.